I wanted to go over with you some questions that I've had some of the public ask, and there's a huge list. I'm gonna be posting them over the next few weeks. But this first one was, does chiropractic hurt? Well, that's a legitimate question because sometimes if you go to a certain chiropractor, it does. But you've got to be sure that you're picking the right one. Well, how do you pick the right one? Well, I always suggest, tell people, it's like try to ask who they go to, or don't just cold call out of a Google listing. Just ask other people, and then check the ratings, the reviews, and that'll give you a good idea. But enough of that. So back to, does chiropractic hurt? Well, it all depends. I know you probably didn't want to hear that answer, but the age difference, well, the older people, a lot of times they're more stiff and they've got more scar tissue and they're not stretching and they're not hydrated. And so, hey there, John, how's it going? But if they're more stiff, then an adjustment, the more you can relax, the better and easier the adjustment goes. And of course, the stiffer you are, the adjustment may not go so smoothly and it may hurt a little more. I don't want to say hurt, that may not, it's more uncomfortable. The younger people, usually it doesn't hurt at all. It's easier to adjust. And but it's not just that. Sometimes people's personality, those uptight, always that are nervous or go on the go all the time and they can't relax. Personality sometimes happens. Now, it could also be previous injuries. If they've had a lot of car wrecks or athletic activities or just any other kind of injuries, then they've built up a lot of scar tissue. And that could make them more sensitive just to the touch, because when you have scar tissue, that you actually have more nerve endings in there to where you do anything in that area and it's more tender. So that's another thing. Now also, you could be dehydrated. So when a person is dehydrated, their muscles are not as fluid as what it should be. And not only that, but also they're more sensitive to the touch. It could be the technique that the chiropractor is using. So if there are correct ways of adjusting and there are not correct ways. It could be catching you off guard. It could be not catching you off guard, because sometimes people will anticipate the adjustment, or they're not feeling comfortable. Maybe they're cold. Maybe they went on the drive to the chiropractor's office, somebody pulled out in front of them and gave them a scare, and they had to hit the brakes, and they're all tense from that, and they can't just relax when they're in the office. First timers, when patients come into the chiropractor for the first time, if they've never been adjusted, they don't know what's going on. They're probably thinking, oh, this guy's going to hurt me, or he's going to twist something, or what is he going to do? I don't know. So when people are a little nervous and they don't know what to expect, it could hurt a little more. But as far as from my perspective, on the way I practice, I try to explain everything to the person, what I'm checking, and then what I'm going to do before I do it, and then I do it. But the more they're relaxed, the easier it goes and the less it hurts. So that was a complicated answer to a really simple question, even though it's really not simple. Does chiropractic hurt? Well, I've been known to do some adjustments that probably hurt because I didn't catch them breathing right and they were relaxing. They were too tense. They were older. They had a lot of scar tissue. So every chiropractor, there's not one out there that has adjusted people and they didn't hurt. But that being said, the type of the technique, your rapport and trust with the chiropractor, the temperature of the room, the comfort of the table, the area that's being adjusted, all plays a part in this. And so what I try to do is, again, I try to explain. I don't know what other chiropractors do, if they do that, or if they're just say, hurt, where do you hurt, lay down, pop, and then you're like, golly, what did he just do? So anyway, when it's a little sore after the adjustment, I tell people to put ice on there for about 20 minutes. That's the best thing to do for that. Sometimes they're sore, sometimes they're not. Most of the time, after a couple adjustments, you've become relaxed, you have gotten to know what to expect, and you're not going to be tense, and then the adjustments don't hurt. So it just really depends. So hopefully that answers your question. Look forward to the next few weeks of several more questions I'm going to answer. So if you do want to call and schedule, definitely call me at 791-0191. We can do an exam. I can tell you what's going on, and then I can explain what I'm going to do before I do it and adjust you. So hopefully that helps a little bit. Hope you have a good rest of your Thursday, and we will talk to you later. Thank you.